Welcome to our first annual virtual Women Helping Women fundraiser. This is new territory for everyone this year, and we so appreciate that you're taking the time to look at the videos we have made. Many of you know me. I've been around for a while, but for those of you who don't, my name is Becky Pohland, and I'm clinic coordinator for the Women's Clinic at Hancock Regional Hospital. This is a job I've been honored and privileged to have for the last 15 years. One thing I can say is that when I come to my work each day, I love coming. It's always different, it's always challenging, and the main thing is I get to help people, which is so important for me and my life goals. Our patients come from many walks of life, and most of them are introduced to us by a phone call. They've been referred by a physician or the breast and cervical cancer program or the Komen program. Somewhere they've gotten our name. And it's a courageous call to make because many women don't like asking for help. And they're self-conscious that they don't have insurance and they don't have money and they need these services. So I always think when they're calling, I try to feel what they're feeling in making this call. Part of my job is to assess these patients, find out what their needs are, and find out what their insurance status is. We see both in uninsured and underinsured women. Nowadays, many policies have very high deductibles, and people of low income cannot afford to pay these deductibles if they need diagnostic or additional testing. So we're seeing more and more patients like that. Especially with the COVID pandemic, people have lost their jobs and subsequently their insurance, and they're at a loss to what to do. So we feel fortunate we can help them. Typical patients, well, they run the gamut. We see young women who are just starting out on their women's health journey, need help making decisions. Sometimes they have a breast lump and they're just terrified they have cancer. We see women in their 40s and 50s that just need annual screening mammograms but don't have the insurance to get it done. And then we see women who are perhaps divorced or have become widowed and all of a sudden are on their own and they don't have insurance any longer. So it's quite a range, and each patient is an individual and unique and different, and we try to realize that as we talk to them. By the time they finish talking to us, we hope they feel like they're respected and have dignity and aren't afraid to accept the help that's going to be offered them, even though it's very hard for some of them. I've seen women come. We had one patient that was in her 60s. She worked very hard as a server at a local restaurant. When she got breast cancer, she couldn't afford the deductibles her insurance was going to charge on all her diagnostic mammograms. So we helped her. Another patient of very notable memory was from Pakistan. She was here in the United States because she was a Christian and she had refugee status as for religious freedom. We helped her. She was also diagnosed with breast cancer and she was young, in her 30s. So I think of people like that have come to our country, been met with love and care, and how that's going to affect how they are on their journey to becoming citizens. When they come to the Women's Center, they are coming to a center that is used by all women for mammography and diagnostic tests for breast cancer, and they are in the waiting room with everyone else. There is no distinction. No one can tell who's who. After they come back to see us, they will see a very highly qualified nurse practitioner, Beth Turpin, which you may have seen her video. Beth is kind, considerate, compassionate. She makes those girls feel at ease and they can talk and tell her. Many times we find additional problems such as hypertension, or some have addiction problems, or some may need some other medical necessities done. And we have the ability to refer these people to different areas. We use the 365, Healthy 365 quite a bit. and we have doctors that will actually cooperate with us and take our patients. This is a very critical year for our Women Helping Women program. As some of you may know, we lost over $35,000 grant funding we were depending on because unfortunately with the pandemic, the Komen organization was not able to honor the grants they had already given this year. They were not able to do their Race for the Cure as usual, which is their big fundraiser, and we were a victim of losing that grant money. We had an angel. We went right to the Women Helping Women Committee, told them what we needed, told them what we weren't going to get, and they gave us everything we asked for, with permission to come back later this year if it wasn't enough. This is because people like you have donated and supported Women Helping Women for over 20 years. There was a little excess left that we could use this year and not flounder. So it is so critical that we continue to receive your support. Next year, we definitely will not have our Komen granting. We are applying for another grant. We're not sure if we'll be able to get it or not, but things are a little bit foggy right now in our future as we sort things out. We do know we don't want to turn women away. We have never ever had to say, you can't come to our clinic because we don't have enough money. And we want to be able to continue to do that. Your funding has allowed us to expand our programs, and I think Beth Turpin touched on that we do more of a holistic approach now and see these women as a whole and assess their needs and get them to the right sources where they can be taken care of wholly. We so appreciate the generosity and support of Women Helping Women. It's an amazing organization with amazing volunteers, and it has been such a great honor and joy to work with Women Helping Women. I want to thank you for the whole staff of the Women's Clinic from the bottom of our hearts, that we are extremely grateful for all you have done, very appreciative. If you ever want to talk with us more about the clinic or have questions, please feel free to contact either Beth or myself, and we will be glad to tell you more. Thank you, God bless you, and we wish you the best.